Hi, I'm Dennis Wackerbarth. I'm the founder of Cats Exclusive. I started it in 1981 and we moved to this location in 2000. What I'd like to do today is give you a little tour of our hospital, and we're going to start with the retail area where we carry numerous products for cats, more than you could possibly imagine. We have foods that are prescription diet and wellness diets. All of the items in our retail area have been inspected and authorized by our veterinary team as being safe. When you first come into the door, of course, you're going to be greeted by our receptionist in our reception area, and then off to the right is our waiting room, designed for your comfort and your cat's safety. One of the things that is very important, I think, that your cat will never see, hear, or smell a dog. The importance there is that it decreases their stress, and if their stress is decreased, then it allows us to give them a better and more thorough physical exam. As we move on back into our exam room area, we have 8 exam rooms, basically all the same, a little size and shape variation. The thing that we've done in our exam rooms is not given any spaces for cats to hide. It's again another stressor for a cat if they get under a table or a bench and then I have to reach down and drag them out. They feel like somebody's coming after them. It makes them anxious, fearful, and again doesn't allow us to do the exams that we'd like. This room is a little bit different. It's used for a variety of things, but one of the things that we do in here is ultrasound and acupuncture. We move back through the exam rooms as we saw before, head down the hallway, headed towards the treatment area. Again, we pass a couple more exam rooms along the way. Our treatment area is designed in a kind of a great room concept, so people can see other people, and if anybody needs help, we're right there. To the right, as you come in, first you have our outpatient pharmacy. Medications are in cat sizes, if you will, not dog sizes. To the left is our laboratory area. Most of the lab work we send out to a regional laboratory in South Everett. We're very fortunate, so close, because we can get most of our stat blood work back within about 2 hours if we have to. This is a little piece of equipment that allows us to do blood work here on those times that we need it. Most of the laboratory work we send out, urine analysis we do in-house because they're more reliable if done quicker. Moving into the center of our treatment area, I'll just sort of go from left or right or counterclockwise. This is the inpatient pharmacy. We spin around. Right there's a piece of equipment called a bear hugger, and that's something to warm cats or keep them warm under anesthesia. It's a wrap that goes around them, and it blows warm air. This is our dental area. On the wall you will see a digital dental x-ray machine. The monitor, radiographs that come from that are just really excellent. The ultrasonic scaling machine is very similar to the one used in your dental office. There's some equipment over there as well for monitoring body temperature, blood gases, for anesthesia safety. We kind of mosey on into our x-ray, our radiology department. Small room, small patients, but this piece of equipment's a Fuji digital x-ray machine. When we purchased it, one of the things that the salesman told us is that it's the same unit that they have at the Mayo Clinic, and boy, the images that come out are spectacular. Great detail, allowing us diagnostic capabilities that flat films just didn't allow. Our surgery suite, heated surgical table, again to keep the core body temperature of cats up under anesthesia, critical. Another bear hugger, anesthesia machine, more equipment to keep track of heart rates, body temperatures, blood gases under anesthesia. An old view box on the wall in case we get referral surgeries and flat films. One of the things you keep hearing me talk about is core body temperature. It's critical in cats. They're so small they can lose their body temperature. and that complicates anesthesia recovery, and we just don't want that to happen. Each of the workstations, they're all pretty similar. This one's a little different. It's more of a bathing station for cats if they soil themselves. And then we move on to our intensive care units, and they are the units that most of our cats go into for hospitalization. The three on the left are oxygen units as well. The middle one has a nebulizer in it that allows us to vaporize certain medications so that cats breathe them in. Right now we have 2 kitties in those 2 units that are on oxygen. The one in the middle is on for a longer period of time, so we're vaporizing or just putting water moisture in there so it's not so harsh. The other thing about these that's nice is they're all heated individually, so we can keep cats warmer if necessary. One of the things that is seen in all of our units in our hospital and boarding or hospitalization units are little air exhaust systems, so that all the expired air is taken out of the hospital, so that no cat ever shares air with another cat. The reason I designed that originally was to reduce the spread of infectious diseases, upper respiratory diseases that might come into the hospital with a subclinical carrier. What I didn't expect to see, or didn't think to see or know to see, because it was a system that there isn't another one like it, or we made it, or I made it 25 years ago. And then we had it built in this one. But what I didn't expect to see is that it also reduces the stress, and the cats just seem calmer. And after thinking about it for a while, I realized what was happening is the pheromones that are released when a cat's here that is anxious, it doesn't waft through the air and create that same anxiety in the other cats, which then creates more pheromones, and you just have this snowballing effect. And all of that, if that happens, it just makes our jobs more difficult. We can't really examine our cats well if they're fractious, if they're frightened, if they're not eating. We don't know how to assess that, whether that's because they're frightened or they're just not responding to medications. This unit you're looking at is one of the many infusion pumps that we have. It delivers fluids at a specific rate for a specific time. And then below it is a heating unit that heats those fluids up so that, again, the cat's body temperatures remain up. We just don't want those body temperatures going down. I can't emphasize that enough. Down this other hallway, and we won't go down there, but in that area we've got our isolation ward, which is where our infectious disease cats go. That area is separate from the rest of the hospital. It's a room that the units in it have not only an air exhaust system, but their own air intake system. So each unit is a closed unit. The room itself has a huge exhaust system, so that before walking in it, you turn it on so that if there's anything that escaped, that it's sucked out of the room before you open the door. You go in, close the door, work in there with that on, and then before you come out, it exhausts the room before you open the door. So now we're going to head on down to the back of the hospital. We pass the employee lounge. We pass a ward on the left side, which is a ward that we use for cats that are skittish and don't want to be up front with everybody else. We'd much rather have them there if we can, but if it's not in their best interest, we'll move them to that area. We went through the feeding laundry area. We're now into the boarding facility. These units are large units. They're probably 8 feet tall. They've got 6 or 7 levels, allowing cats to jump up and down. Each unit can hold up to 3 cats from a household. If there are more than 3, we can open the units so that they can commingle from side to side. The units that we have here are special needs units. They're more, they're on a flat level so that cats can go from front to back a distance, giving them more space. But if they're old guys that have arthritis that can't jump up and down, then they won't be confined to one level. Basically, that's our hospital. I'm sorry to have gone so fast, but in fact, The people who talk about videos say that they shouldn't be more than 2 minutes long, and there's no way that one can make a video of this hospital in that length of time. As I walk up front, I'm going to invite you to come in whenever you'd like, if you'd like to see what we have to offer, what we do, and have a personal tour. We'd love to show it off. It's a wonderful hospital that allows us to practice in an environment that we find pleasing, that your cat will find less stressful, which then allows us to do a better job. Again, call us if you have questions or would ever like to stop by and see us. Thank you very much.